I'm Dr. Monique Yohanan. I'm a senior fellow for independent women, and I specialize in healthcare. Both as a physician and as someone with a master's in public health, vaccines to me are amazing. They are the greatest breakthrough when I think of in public health. I can't think of another one, but I do think that with vaccines that we have lost our way in really what is essential about them. I come at this as a physician, and I come at this as somebody trained in public health. I come at this as a mom whose son got every single vaccine on time. I didn't have any deviation in the schedule with my own son. I'm not sure that I would do the same thing if I had this to do again. For the last few years, I've been really interested in the field of vaccines, and this started with one of the jobs I'd held previously, where I wrote the guidelines for COVID during COVID. One of the things that I noticed during that time is I spent a lot of time reviewing the vaccine literature, and a lot of what I was hearing didn't necessarily match up with what I had read. When I think about vaccines, I start with the idea vaccines are incredibly important, but they are not all equally important, and they are not all equally necessary. As a starting place, there are vaccines that are essential and that are part of our obligation as members of a community. There really are a very limited number of those in the schedule. So I think it's time that we have a reassessment about how we look at most of the schedule. Ultimately, my obligation is to my child, and every parent's obligation is to their child. We talk a lot about shared decision-making in medicine, and I don't know that there's a lot of sharing in the way that we currently approach vaccines. We have a lot of successes with vaccines that we can point to, but currently we have a lot of challenges. We've been doing it the same way for decades. We need to acknowledge that right now we are giving too many vaccines, we are giving them to kids too young, and we're not respecting parents in the process. We took this idea of we're going to have vaccines that are about our obligations to each other as citizens, as part of a community, that we do have moral obligations to each other, but we started giving vaccines that weren't about vaccines that the entire population needed. They weren't about breaking transmission. They weren't about promoting the public health. The first idea was to provide individual benefit. And the other thing I would say goes even a step further, though. And then we said, you know what? Babies are a captive audience. And there are diseases that babies have that they carry, and maybe babies are putting adults at risk. So why don't we start vaccinating babies against diseases that they aren't at any risk for? If you look at the way that we've handled some of our vaccines, the vaccines are not for the benefit of the baby. They are not for the benefit of the child. They are part of a community benefit. I will tell you up front, it's maybe ethically dubious to begin with to not really be straight up with parents that the reason we're giving your child this shot is because we want your child to help this man who's really struggling, who's 55, who's addicted, who's homeless. If your child gets this shot, you might help that man. But it's for a vaccine that doesn't help the child at all. I do think that vaccines are generally safe, but when we give a medical intervention at scale, and we have 3.6 million kids who are born every year, even the safest vaccine is going to hurt some of them. We really have to think about the potential benefit to the child, the benefit to the community, and when we get new evidence, when we have theories about how a vaccine might work, when we get new evidence that says that our theory was wrong, we have to have some humility about this. And we have to be able to revisit the science, and we have to be able to revisit the way that we approach it. Visit Independent Women to read my paper, Rethinking Vaccine Policy.